I have to start taking insulin. What should I take care of? So insulin is prescribed for diabetes, either type 1 or type 2 after certain drugs didn't work. In type 2, there are certain oral medications that have to be started first, and then if it's not enough, insulin is prescribed. And the most thing you should take care about with insulin is the risk of hypoglycemia. So you have to always talk to your doctor. I'm sure he will give you a lot of tips about it, and the pharmacist. But most thing you have to take care is the hypoglycemia. You have to recognize the symptoms like sweaty, loss of consciousness a bit, like drowsiness, the hunger feeling, for example. And you always have to keep pieces of sugar with you, like either 4 cubes of sugar, honey, some syrup. You have to keep this with you just in case you have these hypoglycemic symptoms. And remember, do not inject your insulin before eating. If you have the short acting one, you have to inject it and then eat your meal. But don't inject it and then skip your meal. Like, you have to always be aware that you have to organize your day, the meals, and you cannot just skip them easily and then injecting your insulin. Of course, there are many type of insulins. There's like short acting insulin and there's long acting one. By the short acting, we always say, take care. If you inject it, then you have to eat something. Like this, it doesn't cause the hypoglycemia symptoms. And you always have to notice if you drive the car, if you have this hypoglycemia symptoms, you have to stop, measure your blood sugar, take 4 pieces of sugar, and then measure it again to see if it's in the good value. So this is the main thing I think about with insulin. If you have more questions, you can always ask in the comments. Thank you.